I'm Dr. Ivor Benjamin, the co-chair of the Conference on Professionalism and Ethics. I am joined today by Dr. Bob Harrington. Dr. Harrington was a lead author of the paper and is a past president of the American Heart Association. Dr. Harrington is also chair of the Department of Medicine at Stanford University. So provide us with a little bit more context as to why navigating conflict is important for addressing focus on professionalism and ethics.
I think it's nicely, again, set out in the paper that talks about the concept of we having primary interests and secondary interests. Primary interests are really the task at hand, taking care of a patient, reviewing a manuscript, enrolling a patient in a clinical trial, reviewing a grant. The secondary interest is really the tricky part and where the conflicts might arise. And I'll emphasize the word might, because not all relationships result in a conflict. Or if they result in a potential conflict, that conflict might be able to be managed. And the secondary interest, though, might include things like a consulting relationship with a medical products company. It might include a position of authority at an institution or an association. So these are the things that we need to be first transparent about so that the concept of the buyer beware can be evoked. But we also need to be transparent because we need to make sure as a trusted profession that in fact the public has trust in us. And the public really, I think, wants to know and needs to know what are our relationships? Might those relationships matter in this particular situation? How are those relationships being managed? And who has oversight of that management?